Diabetes is a serious chronic health threat.
Diabetes.
Type 2 diabetes.
With diabetes.
Type 1
Diabetes.
diabetes. About diabetes.
Diabetes.
Anything can go wrong.
Pre-diabetes.
Diabetes.
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 It's amazing how much everything affects your blood sugar.
Welcome to the Okanagan, a place that I have been calling home for over a decade. From our pristine lakes to our alpine mountain trails, I believe that we have a little bit of everything around here. But like every good story, there's always a bit of a twist. Working as a pharmacist in the community, with a specialization in diabetes, I've witnessed firsthand the preventable decline in patients' health due to their inability to manage and monitor their blood sugars. The bigger problem here is that we are not alone. It's estimated that a staggering 1 in 3 people in Canada have diabetes or prediabetes. That's a new diagnosis every 3 minutes, which we have been keeping track of in the bottom right of your screen. Mismanaged diabetes is a leading cause of blindness, causes 30% of strokes, 40% of heart attacks, 50% of kidney disease needing dialysis, and 70% of all non-traumatic leg and foot amputations. But it doesn't have to be this way. In my practice, I've seen that some of the smallest changes have the greatest impact on quality and quantity of life. Over the last year, I've talked to local health practitioners, as well as some of my patients who are living well with diabetes, to share some of their thoughts and opinions to help those who are at risk or currently in a similar situation. And I wanted to share all of this with you. Maybe you might learn something so that you can reduce your risk of developing diabetes and of those around you. So let's go downtown and get a better understanding of the public's perception of diabetes.
That's a hard one. My mom had, she's passed on, and my son-in-law have diabetes.
They come in all different sizes and shape.
I immediately think of people who have to give injections.
I was a school teacher for many, many years. When I first started teaching, I didn't see a lot of overweight kids.
It's bad for your feet. Like, I think if you're elderly, you're going to have foot problems that can lead to really dangerous things.
Average person, just with like a unknown health condition.
When they get low on their sugar, they get kind of cranky, right? They get kind of a little bit cranky, a little bit hangry.
Diabetes isn't particular. It'll take anybody. Anyone's a candidate sort of thing, right?
And I also think that diabetes in an older person, you're going to end up dying.
I think just someone that's trying to maintain their body and try to figure out a cure for this, disease that they have.
When they're little, they think they're superstars. Yeah, they get in front of the class and they're so proud to talk about it and they're proud to show off their stuff. They lift up their shirt, show off all their devices. They think it's great, right? And they're so happy to see, me, I come to the school and I get great big hugs. And yeah, they totally think they're superstars. They all have their own individual nurse. This is my special nurse. She only comes to see me. And then as they get older, they want it to go away. Yeah, and they hate it and they don't want to do it. And they just want it to be secondary to life.
A lot of people come to me with sometimes foot issues, with neuropathies, with vision trouble. So with physios, we can design programs for people to help manage those blood sugars to minimize the effects of all these comorbidities.
If you have a patient that's coming in with a stroke or a heart attack, you want to find out risk factors, what kind of led to them having a heart attack or a stroke. So often enough in turn, then we find out that they are diabetic in that way. Or often if you have somebody that's coming in, interestingly enough, recently had a case where we had somebody coming in with nausea and vomiting and it ended up being that they were in diabetic ketoacidosis, DKA. So that was a new diagnosis that was causing their nausea and vomiting.
I thought I was asking a trick question with that last one, but I think the people on the street actually answered that really well. Diabetes can be anybody. It could be a family member, a friend. It takes a lot of different shapes and sizes. And in my practice, I find that there's no one-size-fits-all approach. And honestly, in a lot of cases, no medication is actually the best medication. But unfortunately, sometimes lifestyle interventions only can go so far. So in which case, that's where we use medications to kind of cover that balance, to kind of help them meet their targets and improve their health. Half of the population that has diabetes actually don't know that they have diabetes. And seeing how type 2 consists of 90% of all diabetes cases, that's a lot of people who go undetected. So we run into problems in the future where you actually have this long-standing undiagnosed diabetes happening. That's when the discovery is made that the blood sugars have been above target for quite a while. I mean, we can have people coming into the pharmacy with symptoms of stroke, heart attack, which we'd absolutely refer out to the hospital. And sure enough, they come back with a prescription that would keep their blood sugars under control.
I don't know, maybe 60%?
If I had to take a wild guess, because I see so many people who are not fit, with all due respect, maybe 40, 45, I don't know, is that low?
I would say not more than, I would hazard a guess at not more than 15 to 20%.
I have a feeling that maybe younger people might be meeting them, but I have a feeling that there's probably a lot of older people, like, 65 up, that are not.
Say like 5%.
What? 13? OMG.
Only 13% are meeting the requirements.
You know what? I can never kind of figure that one out.
That I don't know.
So type 1, is that where you rely on insulin? And type 2, you don't need as much insulin?
Yeah, I have no idea what it is.
I think one is more serious than the other, but I don't know. I don't know what the answer is.
One takes needles and the other one doesn't. That's basically the understanding I have of it.
I think the one is, if I was to guess, the type 1 would be something that you could manage through diet, and the type 2 is probably something that has to have insulin.
So type 1 is that your body's immune system is attacking your body. And so your body isn't producing insulin. And so often type 1 diabetics are diagnosed when they're younger, when they're either children or teens. You can get later, like young adults, I would say, that get diagnosed with diabetes for whatever reason, but it mostly is a diagnosis that's made earlier in life than later.
And there's nothing that they've done to cause it. Parents haven't done anything wrong. The kids haven't done anything wrong. It's a mystery. I always tell the little kids maybe they can grow up to be scientists and figure it out one day, because we just don't know. Yeah. Type 2 is sometimes genetic, sometimes it's just bad luck, but often it's caused by lifestyle, right? Just being too sedentary and not eating very healthy foods. And so you actually damage your own pancreas. You actually kill off your own cells that make the insulin.
Your body's become resistant to insulin. So your body's still producing the insulin, but your body's just not sure how to use it. So that's why still your blood sugar will go high or your blood sugar goes low, more commonly if you're on medications. And now there's actually a type 3 diabetes. So the type 3 diabetes is that insulin growth factor dysfunction in the brain is associated with Alzheimer's disease. And we know Alzheimer's disease is associated with amyloid plaques. And so that's where the cardiovascular risk comes into play, because we know that cardiovascular risk is associated with the development of Alzheimer's as well. So plaque buildup in arteries is what causes heart attacks, what causes strokes or mini strokes. So if diabetes isn't controlled well, then there's that plaque formation, arteries start getting clogged up, and then you have a heart attack, stroke, and then they see me.
Even though type 1 and type 2 diabetes share a name and they seem like very similar things, which they do have very similar targets for blood sugars and cardiovascular targets, and some of the same symptoms, basically just due to the excess blood sugar that your body's trying to flush out, leading to some of that urination and thirst. They're actually quite different conditions. With the type 2s, we actually see a little bit more of the other problems happening first, the heart attacks, strokes, that kind of thing. Whereas type 1 is a bit more of a medical emergency where actual acids are produced in the blood from different metabolic effects. Yeah, and that's actually something that we have to hospitalize these children and get them on insulin right away. So understanding the signs and knowing what to kind of watch out for yourself, maybe some family members that think it might be due to some other causes, is really important for early detection, because with early detection comes early intervention. And with that early intervention, we can kind of ward off some of these other complications that come with diabetes.
I don't like to go to the really yucky side of things, but it's my understanding that you can lose limbs.
You would suddenly get dizzy, like if you haven't eaten, you'd get dizzy.
Getting spacey, like maybe not remembering a little portion of your day.
Maybe like fatigue would be one, change of appetite, maybe like cravings.
Total lack of energy.
And you can lose your eyesight.
Like I feel like you would crave like a lot of sugars because your body's not processing the sugars or not able to make the sugars.
I'm not too sure whether you would actually pass out. I guess you could if it was severe enough.
More than anything, cravings for different food.
And yucky stuff like that.
Maybe like swelling, like in your like feet.
This was before. And swings in mood. Like we used to think, oh my God, like you never knew who you were going to see, Jekyll or Hyde, sort of thing with my mother-in-law.
But I would think, you know that feeling you get when you get shaky? I would think that might be a symptom.
Maybe like headaches and that kind of stuff.
Yeah. And as it turned out, once she got on a program and got her insulin regulated and set up, totally different person, like radically different person. There wasn't the mood swings and all the rest of that. And it was low blood sugar, basically.
So yeah, some kind of, I guess, warning signs that you might be diabetic are if you are constantly thirsty, if you're peeing more often, if you're having infections that aren't healing as well, typically cuts that are taking longer to heal. Being quite tired is kind of one of the other reasons you might be diabetic. And if you're noticing anything that you are concerned about, going and following up with your family doctor. Family doctors are hard to come by nowadays too, so going to a walk-in clinic if you don't have a family doctor, and sometimes coming to Emerge if you're not feeling well.
Like, not necessarily like prevented, but it could be like monitored.
It can be prevented. I don't think so.
Well, they don't produce sugar. They shouldn't abuse sugar.
Oh, absolutely, yeah.
Changing your diet would definitely help, without a doubt.
You could have maybe like less symptoms over time, maybe.
I'm the guilty one. You're having tea? Well, scoop in about 4 or 5. So my wife finally said, that's it. The White Death is out of the house. Get out.
I don't know if reducing sugar will or will not. I'm not sure about that point.
Yeah, like if you were to like monitor your like sugar intake and like your high cholesterol foods, I'm sure, you could keep tabs on it.
So now coffee is really bland, but it's good because it's cut me back to 1 cup of coffee a day. Whereas it used to be like, I'll have another coffee, and that's my 12th.
Yes.
No. Which is sad, but it doesn't.
No, absolutely not.
Yes, it does. I know people who've been cured of diabetes.
I would say false.
Yeah, no cure, unfortunately.
You can improve your quality of life, but you can't cure it. Not at this time.
Hopefully, in maybe like 10 years, our medicine will be, improved.
We can manage the complications with diabetes, but being a diabetic is one of those things that I think if you start helping yourself, it only gets better, and the symptoms can even go away depending on how severe your symptoms can be. So I think it's now's the time to start, and now's the time to be motivated to help yourself and get back some of your function and your health, and live an active lifestyle like you want to. People with diabetes, they don't actually pass away or die from the diabetes itself. It's the comorbidities that come with it, such as cardiovascular disease, So with physical activity, it's really good to help manage not only the blood sugar levels, but it also helps to decrease the amount of fats and cholesterols in your blood, which we know can increase the walls of the blood vessels, making it narrower and causing the blood pressure to increase. So it actually can lower your blood pressures. It also helps to, keep that pump strong, that heart strong.
When we're asking about whether or not diabetes can be prevented, it's honestly a little bit of a loaded question. You see, people with type 1 diabetes don't have a choice in the matter. However, for the rest of us, we're all on a bit of a rate of decline as we age. We're healthier when we're young, and as we age, we get less healthy. And that's inherent to all of us. We all have an individualized rate of that decline. And every bad choice that we make in life contributes to that rate of decline getting worse. However, when we reverse that and we actually make healthy choices, we can kind of shift that balance back and become a little bit flatter, prolonging the time that we actually get diagnosed with diabetes. But that's really only the beginning of this whole complexity of the situation. You see, we're always concerned about the things that cause the most problems in the end. And as we've discussed, the blood sugars, of course they cause problems, but it's more the cardiovascular aspect of diabetes that makes the biggest difference. So even though the diagnosis can't always be prevented, some of the things that come along with diabetes, with the complications, can. So doing something is better than doing nothing at all. Of course, even doing 5 minutes a day of exercise is better than sitting on a couch and eating potato chips. So these kind of things can factor into living an active lifestyle and help to rebalance things out. Due to its prevalence and complexity, a lot of research is being put into diabetes. However, we still don't have a cure. Once a diagnosis is made, that's a diagnosis for life. But there are things that we can do to prevent the risk of developing further complications and stop diabetes in its tracks. So whether you have type 1 diabetes, type 2, gestational diabetes, pre-diabetes, or no diabetes at all, a lot of the things that we'll be discussing here is applicable to pretty much everybody. And so that's what I'd like to focus on for the rest of this series. We'll be following a bunch of my patients and their health practitioners, showing what they're doing and what kind of changes that they've made in their lives to learn that life is sweet and that they can be living well with diabetes. Thanks for joining us for our first episode, everybody. Stay tuned for the next one, where we're going to talk about insulin and some of the costs associated with diabetes management. I'm also going to throw a continuous glucose monitor on myself, and we can evaluate the blood sugar levels of somebody with diabetes versus somebody without. See you then. As we conclude this episode, consider this shocking fact. 6 people have been diagnosed with diabetes in the time it took to watch. This isn't just a stat. It's a stark reality that could affect anyone, including you or your loved ones. Make your health a priority. Schedule a conversation with a healthcare provider today.